Everyone, today we are going to talk about reactions to insulin. Now insulin is something that is very common these days. Since prevalence of diabetes has increased in population and insulin is most frequently given to diabetes, it is important to understand some reactions to insulin, or we can say adverse effects to insulin. Hypoglycemia. So from the name itself it is clear that it is low blood sugar. Yes, insulin can cause hypoglycemia. So, insulin is given in diabetes to reduce blood sugar levels, but sometimes what happens is this insulin can decrease blood sugar more than required, known as hypoglycemia. So, it can be said is as when blood sugar is less than 70 milligram per deciliter, it is hypoglycemia. Hypoglycemia. Now talking about why this occurs. If insulin has been given to a diabetic to reduce blood sugar, it is therapeutic, then why does this adverse effect occur of hypoglycemia? So there are some reasons. So first of all, it is more commonly seen in patient with labile diabetes. What does this mean? Is blood sugar of this person is fluctuating. Sometimes it's high, sometimes it's low, and when it's high, the diabetes will get control with insulin, but when it's low, insulin will further decrease the blood sugar and cause hypoglycemia. It is also common in people who do not have labile diabetes. If they take high dose of insulin, or if they take normal dose but forget to eat food, and another one will be after strenuous exercise. So the symptoms of hypoglycemia, okay, the hypoglycemia caused by insulin, the symptoms can be divided into two parts. Sympathetic system and then neuroglucopenic symptoms. Now sympathetic system is due to stimulation of sympathetic system due to increased epinephrine and norepinephrine, whereas this neuroglucopenic symptom is due to deficiency of glucose, which is the main nutrient, main food for our brain cells. So sympathetic symptoms will be sweating, increased sweating, anxiety, palpitation, tremor. So we can see these all are due to activation of sympathetic system. Now another one, neuroglycopenic symptoms. As our brain cells gets deprived of glucose, there will be symptoms like dizziness, headache, behavioral changes, visual disturbance. Now this neuroglycopenic symptom can progress if not treated at time. Seizures and coma can occur. So it is very important to recognize these symptoms and to treat the patient at the right time. Okay, so for these to occur, for seizures and coma to occur, it is generally said that the blood sugar is less than 40 mg per deciliter. Okay, so hypoglycemia is blood sugar less than 70 mg per deciliter. When it again decreases to less than 40 mg per deciliter, then seizures and coma can occur. So it is generally seen that these sympathetic symptoms occur before than neuroglycopenic symptoms. Okay, and it is useful also because it it is a warning for us that we are having hypoglycemia, we need to have glucose. But what happens is, after long term of diabetic neuropathy can occur, which can abolish these autonomic symptoms of sweating, palpitations, tremor, and anxiety. So what happens is, after long term treatment of diabetes, this sympathetic system tends to disappear and there will be only neuroglycopenic symptoms. Now this can be a disaster for the patient because there will be no warning signs that he is going to hypoglycemia, he is being hypoglycemic. So what is the treatment? What is the treatment for hypoglycemia? Means hypoglycemia needs to be treated right away because the prolonged hypoglycemia can lead to irreversible neurological deficit. Okay, prolonged hypoglycemia can lead to irreversible, permanent, irreversible neurological deficits. So what is the treatment? Is glucose. We have to increase blood glucose level. So it can be given orally, IV in severe cases. Now if the patient cannot take glucose orally, this option is gone, and the IV glucose is not available at that time, glucagon, okay, glucagon, which is antagonist of insulin, 0.5 to 1 milligram IV may be given to reverse the symptoms and neutralize insulin action. So this is how we treat a patient with hypoglycemia due to insulin. There are other reactions as well to insulin, swelling, allergy, edema, but the must know side effect of insulin is hypoglycemia. Thank you all for watching the video.